Hippotherapy is a therapy treatment strategy that uses equine movements in a combined intervention program to achieve functional outcomes. It is used to increase the quality of life in children and adults with mild to severe musculoskeletal dysfunction. People who can benefit from this therapy include those who have been diagnosed with autism and cerebral palsy, not to mention genetic syndromes, learning disabilities, developmental delays, speech and language disorders, and even those who have experienced a traumatic brain injury.
You might wonder why horses are used rather than other animals. The horse provides a dynamic base of support, making it an excellent tool for increasing trunk strength and control, balance, building overall postural strength and endurance, addressing weight bearing, and motor planning. Equine movement can be used to facilitate the neurophysiologic systems that support all of our functional daily living skills. The horse's walk provides sensory input through movement, which is variable, rhythmic, and repetitive. The resultant movement responses in the patient are similar to human movement patterns of the pelvis while walking.
Our horse's name is Lightning, and he has been living at the Kentucky Horse Park for 10 years. He is 25 years old, and he also has a brother who lives with him at the horse park. His name is T-Ball. Horses around this age are used for hippotherapy because they are very mature and far more tame than that of a younger horse. Lightning is one of the many Norwegian fjords horse breeds that are used for hippotherapy.
The program at the horse park used for hippotherapy is called CKRH. This acronym stands for Central Kentucky Riding for Hope. Here is a picture of the building where the sessions take place, and here is a picture of the arena that is used specifically for hippotherapy. Since the development of CKRH in 1981, the program has provided successful therapy for thousands of patients. When it's time for Lightning to get ready for a therapy session, he is taken from his stall and moved to a grooming station where he gets brushed from head to hoof. After that, it's time to saddle up. Lightning's blanket, saddle, bridle, and reins are put on him in preparation for his rider.
Lightning's rider's name is Arabella, a 4-year-old girl who has been diagnosed with mitochondriosis. Mitochondriosis is a disease where the mitochondrion found in all cells in the body are failing to do their job. Mitochondria are responsible for producing energy in each cell, and when they malfunction, not enough energy is produced, causing cell injury and cell death. Mitochondria diseases affect cells of the brain, heart, liver, as well as skeletal muscles, among other places. Depending on where the malfunctioned cells are located, it can lead to things like loss of motor control, muscle weakness, diabetes, seizures, and poor growth, just to name a few.
The activities performed in a session of hippotherapy help the students become stronger in spite of their disabilities, as well as giving them horse riding lessons at the same time. Occupational therapists and horse experts are walking along with the horse and rider throughout the entire session. They are there as helpers to make sure that the rider feels comfortable.
At the end of a therapy session, the riders get off the horse and return to their parents while the horse is guided back to the grooming station to get cleaned up. They are then returned to their stalls for a great night's rest.
See you next time, Lightning!